Welcome to the regular session for the Knox County Commissioners, February 10th, 2026. Today we are joined by Casey Bish and Alina Allen from Ohio Guidestone Region 9. They're going to talk to us about what they do, 988, and some other things. So ladies, I'll turn it over to you.
All right, thank you so much for having us. We are here to spread the word about a really wonderful program. A lot of people don't know that MRSS exists and what it stands for. So it's Mobile Response and Stabilization Services. It is for individuals up to their 21st birthday, and it's to help work through mental health crises. So really, truly, a crisis is defined by the individual. And so our team then comes on board and works to wrap around and have those community resources be a support for the individual so that maybe that crisis isn't such a crisis the next time, or so that they can get linked up with mental health services and work through whatever concern they have, to get to be the best version of themselves. So we really truly are that gap filler, to work so that individuals don't have to go to the hospital. They can maintain within their home, and have their support system.
Right, because it can be very intimidating. Somebody's dealing with something with their child. They don't know, do I call the police? Do I go to the
Right.
hospital? And neither are really quite the right fit. But when you're dealing with mental health issues or behavioral health, they're able to call 988 and immediately bypass 911 and get to you guys
Right.
and be able to reach into 911, I should say.
Yes.
And reach you and get help quicker and then follow up.
Yes.
You work with parents in schools as well?
We do. We work with parents in schools. We work with the guidance counselors, with the principals, the assistant principals. The entire network within the school can reach out to us at any time. And we provide that extra assistance too. So, the guidance counselors, they have oftentimes an entire school of kiddos that they're working with. And so to call us in and say, hey, I need some extra hands in this situation, right? I need somebody to help out. We come and we walk alongside. We're calling the parents while we're en route to the school saying, hey, can you meet us out there? Your kiddo is having a struggle. We want to be able to work with you. So can you meet us at the school? We will do a Columbia screener. We're going to do a safety plan. We're going to do an assessment, and we are going to do everything we can to maintain that child safely in the home and in the school so that they can continue their lives.
Let's talk about the age and the income requirements
Yes.
for your
This is a big one. So we are up through your 21st birthday. So anybody can get a hold of us up through age 21. We do not have any cost to any of the families or any of the individuals. So the state has initiated this entire program, and the state is picking up the cost. So if you have private insurance, if you have Medicaid, if you have no insurance, no visits that we ever come on will ever result in a bill. We are involved with the family for up to 42 days. During that time, every visit that we go out to, no charge with regards to anything that we do.
With suicide being the number one killer of children 10 to 20 years old, it's frightening, right? We live in a very confusing time for kids. We talked about social media and young people especially, trying to get their love acceptance.
Right.
We all need love acceptance and forgiveness. They're trying to get it from basically a platform, a social media place. So social media can be a very damaging, hurtful, bullying place, right?
Yes. Ohio Guidestone is a counseling agency, right? We have been around for over 160 years, and we are the state's leader in behavioral health services. And so we've been around a little bit, right? We recognize that the best way to deliver services is to meet the individual where they are, to meet them in their home. And that's what we do. You make a phone call to us and you say, hey, I'm struggling. We're going to meet you in your home. We're going to sit with you on your couch at your kitchen table. We're going to meet with you in the school. However we can get to you in the space that you feel most comfortable, that's what we're going to do. And we're going to break down those barriers as we go.
So you started September of 2025
We
with
did.
Guidestone um, and 988.
Mhm.
So during that time, I think we've talked earlier, you're finding the age of these people who are using it because you have to be 20 or younger.
Yep.
Is a teenager. Is that correct?
Yes. If you can remember being a teenager, we all know it was a really, really difficult time. And that's what we're finding, is that it's even more so difficult now, like you'd said, with social media and everything being AI and online. teenagers are really struggling. And so that's where the bulk of our work comes in, is really working with those teenagers
Right.
in a real face-to-face kind of, environment.
Right. Used to people would go to a pastor, a counselor,
Mhm.
a parent, of course, and now there's been so much isolation.
Yes.
Attacking and dividing a spirit, like a division I've never seen.
Yeah.
And in doing that, it seems like kids are looking to an AI companion, which is not a companion.
Right.
And so it's great that you're bringing services alongside, but not trying to take the place of parents,
Right.
not trying to take the place of the school, the teacher, the coach. And back in the culture many years ago too, people felt more comfortable. School teachers, coaches could
Yes.
befriend kids and encourage those kids that were really didn't have support at home. And now the culture is even more alienated, and with all the pointing of the fingers, it makes it harder to actually do those things that made us community in the past.
Elena, you're the clinical supervisor for
Yes,
the
that's
area.
correct.
So briefly, what is your duties as the clinical supervisor, and what's some of the hurdles that you face as the clinical supervisor?
As Casey discussed earlier, one of the hurdles we're having is getting our name out there, letting doctors' offices, other mental health agencies, schools, just communities, especially within Licking and Knox County. Yes, we have the larger towns such as Mount Vernon and Newark, but all of those smaller towns on the outskirts of the county, letting them know this is a service that is available to them. And also then linking up with those appropriate longer term mental health services. So really working to build the relationships with these other community mental health agencies and showing them we're working together. We are a very short term program of up to 42 days. We are hopeful if we are referring a client to you, you are going to be that long term person for them. We got the work started, you're going to continue what we did with them. And our team, well, in my role, a lot of it is providing different trainings to the staff. So documentation, making sure we're hitting those different marks, but also how do we individualize those safety plans? If we need a different one for the school, sports team, or the home, how are we doing that? How are we bridging these gaps of communication between family members, schools, and kids? So really working with our team to come up with some of those creative interventions of working with kids who maybe aren't super communicative, helping them get over some of that fear and anxiety of speaking with somebody in person about very vulnerable topics. So providing different ideas to the staff and discussing with them different successes and barriers that they're having in the field as well.
So the cry that I've heard from both of you, or the message I should say, is awareness, people knowing about you. Are the schools being compatible with what you're doing? Are they willing to work with you? Have you had good success with that?
We have.
Yes.
The schools have been wonderful, and we are so grateful for their team members and their teachers and their guidance counselors for reaching out.
Mhm.
That's a lot of times that's our best line of communication, is being able to say, can you just let the parents know that we're here? We don't want to only be available during that crisis, right? We want them to have our number on the refrigerator and be able to call us if something happens at home.
So you're assigned to the Knox County area and other areas in our location, right, for the
Yeah.
state?
We are Delaware, Morrow, Licking, and Knox. So we are Region 9.
And you
And-
mentioned you had 35 people on staff.
Yes.
And if they're in another region, that 988 number gets them to whoever's in their area to
Yes.
support anyone that's a younger person having behavioral issues and having mental health issues.
Absolutely. 988 operates geographically. So wherever you call from, that's where it's going to hone in on that. And so, in this area, we are Delaware, Morrow, Licking, and Knox. But if you call from Columbus, you're going to get Franklin County's team.
Sure. How do you go about marketing yourself, for lack of better words, but it is marketing yourself?
It is. And it's marketing for good cause, right? We are pounding the pavement. We're going out and meeting with schools, and, we're meeting with commissioners. We're meeting, with anybody and everybody that has a voice within the community, because ultimately this is a service that is free to all families, all individuals within the area.
And I think it's important because you guys fill the gap
Yeah.
of a lot of agencies that we deal with and are familiar with. So you kind of have that gap between that's filling
Right.
that area.
It's that gray space that never was touched before.
Yeah.
It was either I'm going to deal with it deal with it, or I'm going to go to the hospital. And those were the two options. And now there's this entire continuum in the middle that people have access to. And I think that's our biggest thing, is making sure that people know what's available.
And do they give away their rights, Casey, when they do contact you to their, saying their autonomy as a family or their religious beliefs or any
Oh,
of the things
goodness,
that
no. So Ohio Guidestone started as a religious-based or religious affiliated organization. And so we try to meet people where they are in all factors.
So you honor their background, their faith, their
Absolutely
whatever
do.
they believe in their family. So you're not trying to take the place of the
No.
parent and the family, but you're trying to come alongside them and give them the tools of maybe it's communication, whatever things that maybe distresses that they're not talking about because everybody's working too many hours and pulled in all directions, right? And it's very easy to have misunderstandings and hurts that occur, and kids today don't have the sometimes the communication skills even as much as they maybe in the past did because they're so reliant on technology.
Right. We truly do walk alongside them, and whatever that looks like. They are the biggest advocate for themselves, right? And we want to make sure that they can advocate in a way that says, you're the professional when it comes to you. Help me understand what you need so that I can give you the resources that I'm aware of.
I think it's important because we've kind of worked around the area, but that people know you're not a clinical advisor. You're not doing any clinical or medical advisory. You're
Right.
putting them in the right direction to receive that help.
Yes.
So you're a liaison between those who can help and the person that needs help.
Right. We do have counselors on staff, and they're the ones that are doing the assessments, right? So we have a pair of two individuals that are going to go out on any call. And so we have a therapist that's going to go. They're going to be the one doing the assessment, the Columbia screener. Everything, the information gathering is going to be done by them. And then that information is going to follow the individual to their next stop. So if they get linked up with another community health agency, if they get linked up with another counseling agency, that information follows them. So it doesn't have to be repeated. We truly are. We are liaisons within the field. And so our hope is that we can collaborate and communicate with all of the other agencies that provide that assistance.
Andrew, you may want to put this on our website. I know we have 211 on the county website. You may want to put the 988 on there as well.
I believe we actually might have a reference to 988 on our site as well. I'll double check that though.
Yes, I saw it
Can we-
actually out on our bulletin board out,
Okay,
the
great.
media board out there. It came up as I was walking in, actually.
Yes, 988 is wonderful. They've been such an amazing partner. They have social workers on staff, and so they can mitigate a lot of these concerns when you call in to 988. But if it's something that really truly needs an in-person feel to it, that's where they dispatch our team. And within 60 minutes, we're there, boots on the ground, ready to have that conversation.
All right.
So 988 is for anyone that's struggling with
Yes.
suicide, mental health issues, any age,
Anything.
but then they can push it on to your agency.
Yes.
Then if it's someone that's under under 21, I guess.
Perfect.
I appreciate what you do. Thank
Jason, you have
much.
That's it. No, thank you.
we appreciate you ladies coming in. You did a great job for the last 45 minutes, an hour between WMVO and us. And I
Been
think
very
it's been
gracious.
very educational, and we appreciate
Great
you
to meet
coming in.
Thank you.
Hopefully this helps you spread the word.
I sure hope so.
Yeah.
And if anybody has any questions, you're welcome to get a hold of me. You've got my contact information.
Thank you very much, ladies.
Thank you.
Thank you.
I will leave my contact information for you as well.
Thank you.
Have a good rest of your day.
You too. Nice
you.
to meet you.
Nice to meet you.
Appreciate it.
Good information.
Everybody knows.
Hello, how are you?
Morning, doing good. How are you?
So you're gonna talk to us about IT today, right?
Yes, I am.
Glad to have you.
Thank you.
Trevor, I think you can go and get started if you want.
Okay.
That's fine. He'll be right back. So. We're running a
Minister
little bit late.
report, yes. So tell us what's been
Yeah.
going on with your IT tickets. You had
Cool, yeah.
285 tickets?
We've been, January felt really busy. A lot of the guys were coming up to me and saying, what's going on this month? What's happening this week? So we had a total ticket count of 285 last month, which, that doesn't count for like phone calls and people just dropping into the office. So we were pretty busy.
Is that a lot of New Year's planning or?
I think so. I think it's a lot of
It
just
gives you-
hold over. People just kind of hold off on issues until the next year, just all at once.
Right.
But for the city, 90 of those tickets were for the city. So a good balance, kind of what we anticipated. Um, Last month, I talked a lot about the advent of AI and the impact it's going to have on computer prices and inventory. So we've already started to replace machines in a number of departments, juvenile probation and our county probate court. They're all getting new machines. So that's in progress
Great.
and done. We finally got all of our externally facing servers into our secured web host. So we previously had all of our eggs essentially in one basket. So we put our most sensitive or more secure ones in kind of a sequestered environment so we can keep an eye on them. And if there's any issues, it doesn't spread to any other virtual machines or servers. So that was a large project that we got done.
Right.
The Parks Department upstairs, they're moving to as everybody calls it Dr. Fowler's office
Yeah.
across the street. I call it the ODNR building. But we pulled a lot of cable and got them ready for county business use. We pulled about 300 foot of Cat5 network cable and did a bunch of like the data drops for computers and phones. So that building is now ready for use. Oh, the panic alarm system. We started doing monthly department checks. We used to just do like a back end system test, but this one's a little bit more involved. I go to each department and I say, have everybody identify where their panic buttons are at in case they need to use them. And then I have them press the button so they get an idea of what it would be like if they have to use it and just kind of like a tabletop
I actually
exercise.
called Jason on Friday and said, there's some excitement going on here at the commissioner's office.
That's
We-
good.
Yeah, everybody gets
This
the
is-
tickets.
You've done it before. Sometimes your mind doesn't know what to go.
Yeah. Well, some people, they don't even know where they were. They're
Right.
like, oh yeah, I have one right here, and it's just gone. So we're pulling them out of desks and we try to stick them under the table so where they're gonna be sitting at, so if something happens, they can just hit it right away, so.
Okay.
Another thing we knocked out was an asset and inventory management system. This is for internal IT equipment. So each department might have a network switch and other IT equipment that we need to keep track of. This will allow us to monitor when the equipment went in, uh, whether it's going to need to be replaced, and then we maintain software inventory to make sure everything is all up to date and secure.
Fantastic.
So that's
Great.
something that we're very happy to use.
That's good. We can budget better when we know what's coming.
Exactly, yes. A big portion of the city move was completed. We got the rack and the uninterruptible power supplies installed. So basically the foundation of their IT equipment is the rack enclosure and then two very large battery units that will take over in case of a power outage. So we got those in and it was just a large part of the project that we were happy to check off and get that done. And another thing worth mentioning are the staffing changes. Our administrative assistant is moving to the commissioner's office.
Yeah.
So we're kind of restructuring the department a little bit, identifying who's going to do what, and just getting ahead of the change already, moving our phone system around a little bit, changing the minor administrative things, but we're getting ready for that as well.
Right. Sounds like you have a good grasp on it. So what do you have coming up?
The ongoing projects, one that's worth noting is the clerk's title office. That was previously under control of the state. They did their phones, their internet, and all their entire network was managed through the state. Well, their service hasn't been very good as of lately. Their internet falls off, the phones don't work, they don't have internet some days. So we decided to bring the title office under our wing. So the guys and I have been in and out, pulling cable, getting ready. We have Spectrum Internet's going in this Thursday, and we've got new phones coming in. So should probably have them. They'll be connected to the county probably in a couple of weeks.
Perfect.
Right.
But that's about it. Still kind of working through a little bit of the ongoing projects. Some of them you might work on it for a little bit and you don't hear anything for 3 to 6 months.
Sure.
A lot of times we're kind of at the mercy of vendors, particularly like for the city muni moving to the Equivant project. We're just kind of facilitating the vendors in the servers doing data conversion. So we click a button when they ask and we move things when they need it, and basically just babysitting the project.
Great.
Perfect.
Anything you need from commissioners or from us to support?
No, it's been good.
Appreciate you. Appreciate
Thank
it.
you for all you're doing.
Jason?
Thanks, Trevor.
No problem.
Thank you, Trevor.
Have a great
You're
day.
welcome.
Appreciate you.
Commissioners, we only have one item of business today. We've completed our, I guess, our every 3-year process, right, Penny?
Yes.
For the CDBG, CHIP and home grant programs. So we have currently used CDC of Ohio for many years. And then every 3 years, we're required to do a request for qualifications. We go through that and then we select, the vendor. So after kind of going through those, we decided to stay with CDC of Ohio, and that's our recommendation that you would approve hiring CDC of Ohio to perform the administration and implementation of those grants. They do that for the city, they do that for the county, and they have for many years, and they do a great job for us. So as we graded those, obviously that kind of they rose to the top. So that's ready for you to formally approve hiring them for another 3-year period.
Okay, we'll take a motion to approve.
Second. Those in favor, say aye.
Uh,
All right.
And then other than that, we just have some bills and a couple transfers and some minutes. And I think, oh, I guess Penny, you did give me, there is one, just the sheriff did submit his meal report for January. 7,928 meals at $1.85 per meal. So he did submit those. And the current jail count is at, as the time of this report was at 120 female, 80 males.
Average stay, 5 days, maybe.
See, does he have?
very bottom.
Oh, yeah, five for. Yeah, it must be 5 days for female, 5 days for male. Yep. Yep. So we'll get you those, and that's all we've got today, Commissioner.
All right. Motion to adjourn.
Second, all in favor. We stand adjourned.